Hello, I am your host, Kathy Chester, and welcome to the Move It or Lose It podcast, a podcast about all things that move the mind, body, and soul. The Move It or Lose It podcast is for information, awareness, and inspirational purposes only. I am not a doctor, and I don't even play one on TV, so please consult your doctor before making any medical decisions. The views expressed by advertisers, guests, or contributors are their opinions and not necessarily the views of the Move It or Lose It podcast. Okay, welcome to another edition of Move It or Lose It. And today we are very excited. We got a little panel going on. So I'm very happy. I've got Dr. Joshua Katz, who I've been waiting, very excited to have on. We're going to talk about several things. And Dr. Katz, thank you so much for being on Move It or Lose It today.
My pleasure. Thanks for having me.
Absolutely. And we've got Hannah and Jacob with us today, and we're also going to discuss HSCT and some other things. So first off, Dr. Katz, if for anybody who doesn't know you, I'm not sure who does not know you in the MS community, but you are the director of the Elliot Lewis Center for Multiple Sclerosis. And you've got a huge, so much that I couldn't even read, all and catch up on. But we just started talking, and I was like, we got to start doing this now because you've got so much to say and very exciting stuff, lots of trials and stuff, and I'm very excited to have you on. So you are now working. You've got some things that you're doing now, some clinical trials, and you're working primarily with MS right now and have been. So talk to us about what you're doing right now, or whatever you want to share, because you had so much that was very interesting.
Sure. So we work almost exclusively with MS, although I'll include neuromyelitis optica, the other demyelinating diseases also. Most of my time is spent in clinical practice. We've got something like 2,500 patients between myself and Dr. Booley. But we also have clinical trials that we're doing. So we do a combination of independent research. We're doing a long-term safety trial in patients who are on anti-B cell therapy. We're looking at different infusion regimens. We're looking at trying to eliminate steroids prior to giving anti-B cell therapy.
Yes.
Time, and some people have side effects to it. And so far, it looks like people seem to tolerate doing that without steroids under certain conditions. And we have also industry-sponsored clinical trials. And the two that are, I think, the most interesting right now is there's a trial for a drug called frexalimab. We're involved. There are two phase 3 clinical trials for that drug. We're involved in the one that's comparing it to placebo in non-active secondary progressive MS. There's also a trial for frexalimab for relapsing MS. And we're involved in a clinical trial for one of the BTK inhibitor drugs. These drugs are getting a lot of attention now because they look like they have the potential to treat progressive forms of MS. And we're in a trial of fenebrutinib comparing it to ocrelizumab.
Okay.
One of these drugs might even become available at the end of the month. And so I'm very excited about these drugs.
Yeah. That sounds so. One of them will be able to help with primary progressive and all that as well.
Hopefully, any of the drugs that work for any form of progressive MS, if it works for primary progressive MS, it should work for secondary progressive MS, because really, if you look under the hood, those two things look exactly the same in terms of the biology of what's happening. Now, it doesn't mean that insurance will cover it. If they did a trial for primary progressive MS, they might not cover it for secondary progressive MS. But, it could be.
Well, we love insurance. Insurance is our favorite. I cannot tell you how excited I am to announce my partnership with FootScientific. Their Elevate 360 drop foot solution is amazing. It's lightweight. It has customized sizing, which is amazing. I've been in braces where they are much too big and bulky. This one has memory foam. It's comfortable. I have walked my dog. I have run with it already. I have danced in it, and it is amazing. It has stainless steel anchors, which you can wear them in any shoe you want to. But to be able to have them connect to your laces so that you can lift the foot so that the drop foot isn't so bad and know that they're safe in there is so incredible. To be able to have this to be able to have it on your ankle and then attach it to a tennis shoe, to attach it to a heel, actually, or a sandal is absolutely amazing. I cannot tell you how excited I am to be a part and partner up with Foot Scientific. They are truly here to meet our needs. So I encourage you to go on to the website at footscientific.com, check them out, and of course, use my discount code. It is MS Disrupted, all caps 30, and you'll get $30 off your pair. And also, don't forget, 60-day guarantee. If it doesn't work for you, then you can return it. And that is why I love Foot Scientific. They're a company that truly cares about our needs. So don't forget, check them out. I love my partnership with them. Have a great day. So those are the biggest trials that you're working on right now.
Yeah. I think
Okay.
those are the ones that are, I think, the most promising and interesting.
Okay. Very interesting. It's always interesting what's happening in the MS world that we don't know always as patients.
Yep.
So to have you on is exciting to hear. So I know you were at the men's group. You were speaking at the men's group now 2 weeks ago, 3 weeks ago.
Well, that was not just a men's group, but Matt Price and his wife Rebecca put on a whole educational program down in Branson, Missouri for a couple of days.
That was
so I
neat.
got to speak down there for a couple of days.
Yeah. They I know a lot of people that were there, so that was really neat to know that you were there with them. So very exciting. So we wanted to go over several things, of course, and we have Jacob and Hannah because they both had HSCT. And so one of the things that I wanted to talk with you as well is kind of the benefits and kind of the things that don't always go great with HSCT, kind of where we are as an MS group as far as where are we as far as pushing this more and where are we as thinking maybe this isn't the best thing, maybe this is getting, maybe people are, MS patients are getting more of the HSCT or less, and just kind of wanting your opinion as far as HSCT, and then I want to hear a little bit from Jacob and Hannah as far as their experience was with it.
Sure. Well, I want to start out by saying that when we talk about HSCT, it isn't just one thing. It's really a bunch of different things that all go under the same heading. So there's a non-myeloablative form of HSCT where you're using relatively weaker forms of chemotherapy. And then there's the myeloablative form of HSCT where you're using much more toxic medication and getting a much more deep suppression of bone marrow. And we found, if you look at the trials, the myeloablative stem cell therapy is both riskier and has much more complications with it, but also has better results. And this isn't a surprise because the deeper you suppress somebody's bone marrow, you would expect that to have a better impact on an autoimmune disease. And then the non-myeloablative form of HSCT, depending on where it's done, they use different regimens. And so it's really hard to compare all of these things when you're looking at efficacy. There was a recent paper that was published that looked at they compared HSCT to some of the higher efficacy treatments, and they found that it looked like it might have been a little bit better at suppressing relapses, but basically only with Tysabri it looked better. It really wasn't better than ocrelizumab. It was better than fingolimab, but one of the things that I've seen with HSCT is that as it's gotten better and safer, our treatments have sort of kept pace with it so that our high efficacy treatments keep getting a little bit better, almost in line with HSCT. So another thing about HSCT is it's not an FDA approved treatment. It's still in trials. And so there are a number of trials that are going on comparing it to high efficacy treatment. But you can't just go out and get it unless you either want to go to another country and pay out of pocket or you get into a clinical trial.
Yeah, I think that is something really important is that right now, Mexico obviously is a big area that a lot of patients go. And so Jacob, you went to Mexico, correct?
Correct. Yeah. Clinica Ruiz.
Okay. And then Hannah, you as well?
I did.
Okay. And then
Clinica Ruiz graduates.
Yes.
Yeah.
I was in Monterey.
And I was in Puebla specifically.
Gotcha. Yeah.
I didn't even know they had two different locations.
Mm-hmm.
Yep.
Do you guys, Hannah, do you want to share a little about your story with HSCT?
Sure. Yeah. So I'm Hannah Butler, and I'm down the road from you, Dr. Katz,
I was going to say, I think you
In
are.
East Long Meadow, just outside of Springfield.
Okay.
Yeah, so not too
Are
far.
you going to UMass for your care?
I'm going to the Mandel Center in
Okay.
Springfield. I was
Yep.
in Hartford, but they opened it, 10, 15 minutes away. So that's where I am for now.
So just a quick nod to if you ever saw Peter Wade, was he happened to be your
Oh,
physician?
he
Yeah.
wasn't, but I
Yeah.
knew how beloved and,
Yeah.
what a wonderful man he was and
Yes,
doctor.
a friend and colleague, and very sorry to lose him a
Hmm.
couple of years ago.
Mm.
Sorry
Yeah.
for the aside there.
Oh, that's okay. Not at all. So I was diagnosed with primary progressive MS in 2017. And I actually didn't know what type of MS I had. I kind of assumed it was the other. I didn't even know there was a primary progressive. So I switched from that practice to another one where I got a lot more insight. But
Mhm.
with that, you know, symptoms were a little mild at first and then kind of continued on and to where I left work. And then I did start Ocrevus as well. And then right around the time it was the fall of 2019 and then heading into 2020, I kind of felt like it was my right leg was dragging a little bit more. And I reached out to my neurologist just saying, is it worth exploring something else? And she had said, well, I had only had one dose, and she had said, maybe let's give it another and we can talk about it. So with that though, I did come across HSCT. My sister did actually, and we started to do a lot of research. And I looked into Clinica Ruiz. By the way, it was COVID at the time, so that we had to take into a lot of factors, and Russia was closed. They weren't accepting anyone coming in. So I did some research. I spoke with a few folks that had the treatment down there. And the only person I spoke with that had PPMS or has it, she was in Russia. And I don't know if she was, I think it's non-myoablative, but anyway, I just wanted to get her take. She did very well on it. She had a rough 14 months recovering, but overall there was no relapse. She has since, I think it was last year, relapsed and she went for it again. So we'll see how it goes. But anyway, I chose Clinica Rees. There are two locations. Monterey has where you cook your own food, and I believe Puebla, it's more you can have the food that they provide. There's like, I think a cafeteria. I'm not sure. You can talk to that, Jacob. But I liked the thought of cooking my own food. So I signed up and I went down in the fall of 2020. So my treatment started in October, and my actual stem cell birthday, as they call it, was November 13th. I will say the Clinical Rees, it's like the best care I've ever
Mm.
had, from an attention to detail from the minute you get out of the airport to when you leave to go back into the airport. I mean, just very
That's what I heard.
attentive. Yes, I was blown away. Phenomenal facilities, just the patient care. And even you had a person you could call 24/7 while you were at your apartment. And it just I was just really like I said, just really floored by it and
Yeah.
appreciated that, because I've never flown out of the country to get treatment. I never even really had a major treatment. And by the way, it's during COVID, so there's just a
Yeah.
lot of factors. But so I will say that was a huge positive. And a big reason also I decided to pursue this is some of the statistics that they provided was there was a 75% um, success rate for PPMS. Again, let's see, I don't want to discredit it, but you just maybe not sure. But talking with my neurologist, she was very supportive.
Mm.
Um, the medicine I was on had a lower rate of success with PPMS. So at the time, it was the decision I wanted to make. I really wanted to see if this could help me because I could tell things were shifting. And at that time, I was 39 and I had two kids, one starting kindergarten and first grade. So, I'm looking ahead, and I just really wanted to try something. And so I was accepted
Can
in.
I
Yeah,
interrupt you for 1 second? Because I have
sure.
a question. When they say 75% success, what does success mean?
For them, what I believe, and this is a ways back, is that it halts progression.
Okay. All right. And
Not, yeah.
can I ask also, what did you look like going in when you, what were your symptoms?
Yeah. I was a 3.5 EDSS
Yeah.
on the disability score for anyone listening, not sure. So I went in with foot drop, and so when I think of it, I always kind of measure it by mobility.
Yeah.
Today I don't, but back then it was a foot drop, and I was noticing it was increasing. So took a video of myself walking at Dallas Airport, and I was walking I didn't have a mobility aid, just an AFO. Um, and I did have some other symptoms, tingling, some bladder stuff, those things. But going into it, that was my disability score. So early on, with all the medications that you start to get, and then the chemo, I quickly became deconditioned. I was just so tired, and I started to notice, I was getting weaker, so I needed to use a rollator. And I was like, oh, it's only going to be, a quick thing. Um, I did fairly well with the chemo, and it's non myoablative, so it didn't bother me too much. I think I had a slight headache one day, so I was really pleased with that. Unfortunately, what happened was after the stem cell transplant, November 13th, I became severely anemic, and I needed two blood transfusions. And that I can say will be more common, I guess, for a complication. But then shortly after that, I actually, right before the blood transfusions, what led me to the hospital was I um I had a really bad headache and fever. And overnight it did break. I was taking medicine, and I woke up and I had gray spots
Mm.
when I would look and see. And it turned out that I had blown both my retinas.
Oh, that's an odd
And
Wow.
complication.
it is
Yeah.
very odd. It was the first. And of course I'm like,
Wow.
that's me. I'm your first.
And
So
why, what does that mean? You had retinal detachment or
not, I shouldn't
CNV
say blown.
retinitis?
I wouldn't, it was whatever it was that I had gray spots hindering, and they did correct themselves over
Yeah.
time. I would say
Okay.
one was maybe a month, the other might have been like a month and a half. They got me right into an ophthalmologist, and again, right in with one of the city's top. The facility was like futuristic. So again, I was really impressed by that. But in thinking about joining this, talking about complications and coming onto the podcast, I don't. I didn't really ask why it happened. I don't know what if I did or not. I just wanted to get healed and get home.
Sure.
So I don't.
Mhm.
Did you ever find out what happened?
I didn't. I don't, and I don't know if it was because they'd never had it happen. So it is a question like, hey, following up. I just
So they
didn't.
were not able to diagnose you.
No, no.
Mhm.
But all I know is the night that I had the fever and the headache, I woke up and I was like, I'm seeing gray spots, and they were very concerned with that. And then I think actually the blood transfusions were before. I'm sorry. Those were my two main, those were the two complications that I had. And obviously the retina was pretty significant.
Yeah.
So I had to stay an extra week down there. So I was there a total of 5 weeks. Typically it's 4. We were able to fly back, and then just came, getting back into my home. And it's now getting close to, we're entering Christmas season. So I was told from one of the people I spoke with to um, take the first month just to rest, but start to do some movement after a month. And I had a home PT come. And at that time, I was walking still. I didn't have the rollator the whole time because I had regained some energy. But I still needed the AFO. I still had the foot drop, and I understood that. Those things weren't going to magically go away. So that was around the beginning of 2021 into the spring. But fast forward 5 years later, unfortunately, it didn't work because I've significantly progressed. I'm at a 6.5 EDSS. I
Yeah.
do require my left leg joined the party, as I like to say. I think the fall of 2022, I started to notice same symptoms I had way back in 2016. So as of now, I use a rollator. I was using walking sticks. I can no longer. When I go out and about, I use a scooter now. I rarely use my rollator because my walking's just been um just considerably it's been impacted. So, you know, had I if I hadn't got the treatment, who's to say it wouldn't have progressed that way, so I don't
Exactly.
quite know. I have heard, I listened to a different podcast with a doctor that was performing it and mentioned that there's something about the fever, and the fever
Mm,
can disrupt something with the neurons and kind of
mm,
accelerate. Maybe that's what happened. I don't know.
Well, I
I'm
will
not
say
sure.
it's a little odd to me because fever is such a common complication
right.
of stem cell
Right.
transplantation across the board. I mean, that is the major complication the reason that you stay under observation is that during the period of time you have a weakened immune system, it's pretty common to see
Yeah.
people
Yeah.
develop even, at least a low-grade fever or have infection.
Right.
So
Right.
if that's the problem, it's going to be a problem with stem cell transplantation in general.
Right. And I'm glad you said that because, when you listen to different views and researchers, you're not sure. But I I look at it and I knew it was the right decision for me at that time. I wanted to do something to see if it worked. My neurologist was on board. So I don't regret it, but it is
Mm,
hard to wonder if things progress as quickly, but also everybody is different.
yeah.
PPMS, it's that's that kind of
Yeah.
that 10% of the group,
Yeah.
and
Introducing the Pulse device. Cutting edge wearable device, revolutionary wellness designed to stimulate circulation, reduce harsh pain and tightness, and speed up recovery. The Pulse device uses advanced vibrotactile technology trusted by patients, clinicians, and wellness professionals. Whether you're recovering from an injury, battling a neural condition, or just want to feel the best every day, Pulse helps you recharge so that you can live and feel better. Lightweight, powerful, and easy to use. Experience better performance, better recovery, and a better you. Order now and save $30 using my code MSDisrupted at pulsedevice.com. The Pulse device is your health recharged. You won't be disappointed. Get it now for yourself. I have it. I love it. Go ahead and grab it.
So what I'm thinking is this really um, reminds me of a conversation that I'm having with another one of my younger patients with primary progressive MS. When you mentioned not regretting having gotten it, I'm glad to hear that because I think it's so easy to second guess your decisions when you don't do well.
Yeah.
And first of
yeah.
all, the bar that they set for success, which is to stop progression, is an extremely high bar.
Yeah.
We don't really even have that bar when we put people on ocrelizumab. Ocrelizumab, our
Mm.
goal is perhaps to slow progression. It's not impossible to stop it, but we really are trying to slow it down. And the other thing, which you touched on, is you really never know when you've accomplished that goal because we
Yeah.
don't know the counterfactual of what would have happened to you had you not gotten the treatment. I mean, it could
Yeah.
have been the same, could have been better, could have been worse. We don't know. But, my guess would be that the treatment did something. But the
Mm.
bigger problem right now is that we really don't have any reliably effective treatments for progressive forms of MS. And this,
Mhm.
unfortunately, has been proven to be true mostly for stem cell therapy as well. It is very effective or can be very effective for relapsing forms of
Mhm.
MS, but the statistics are not nearly as good for progressive MS. My three patients who went and got stem cell therapy, well, there was a fourth. Three of them had progressive forms of MS, and I don't think it worked really in any of them to substantially slow their progression. Very hard to know, but it just doesn't make a big difference for most patients. But was it wrong to try it? No. I mean, you may have accomplished something by doing that.
Yeah, and it's a good angle to look at it. And again, it was the best decision. It was the right
Mhm.
decision, I should say, at the time. And obviously, to hear the information you're providing, I might have liked to hear some of that, but what I was hearing was the 75%. And my neurologist didn't know too much about it, and that's okay. I mean, they may not. I was her first patient to have it. So, I don't think, she didn't have the clinical information. And maybe if there was some more, she would have, but I don't know that it would have changed. I don't know. And
Yeah.
so I did go and, you know,
I think it's, again, it's very hard to second guess. So the reason I said this reminded me of a patient is I have a patient who decided to go into a clinical trial because they were not doing well on one of the anti-B cell therapies. She's in the clinical trial for frexalimab. I don't know if she's getting placebo or not, but not doing well, and then really second guessing the decision to stop B cell therapy. And I'm reminding her, we did this because you weren't doing well and we didn't really have any other good options. But when you're not doing well, it always feels like every choice you've made was the wrong choice.
Yeah, no, very true. That's
It isn't. It's just it leads you to second.
yeah.
right,
Yes.
right. Of
I
course,
do have
I
a
think
question, Dr.
anything.
Katz. When it comes to like how Hannah's feeling now and how she is feeling like, gosh, I'm just declining. Do you see that? Jacob and I talked about this earlier, and I'm not speaking for you, Jacob, because I'm asking my own. I'm not saying this was your question. Do you ever see patients that have had HSCT go back and get like another boost of like chemotherapy or anything like that to help?
I have not as of yet.
Okay.
Yeah. And
I wondered if that was
I'll tell
something
you
that
the
they
thing
do.
that I'm a little bit cautious about. And first of all, we really don't have the data, comparative data with HSCT, at least in big clinical trials, to compare it to standard therapy. But we know for a lot of people, the standard therapy isn't working. And I think under those circumstances, it absolutely makes sense if somebody can offer you, like credible statistics that something works. It's absolutely reasonable to try it. I mean, I think about this all the time. If it were me, that's probably what I would do. If I weren't, if I wasn't doing well and somebody said, look, this is as aggressive as you can be and the statistics show some chance of it working, absolutely makes sense. But one caveat with that, somewhat specific to Clinica Ruiz, is that the numbers that they quote are sort of unusually high and better than what you're seeing with some of the more rigorous trials that have been done. So Richard Burt, who is probably one of the leading researchers in HSCT, has more, I think, numbers, at least has published more numbers, and the statistics are pretty good in relapsing MS, but they're not Clinica Ruiz good. So it makes me question that a little bit. And, you talk about how good your experience was going down there. And if it wasn't good, people wouldn't go there.
Right.
Absolutely.
You're not going to go to another country and have somebody come back and say, well, it was a little bit, it didn't look like it was all that. It was nice, but a little bit sketchy in places.
Right.
That's the end of that program, right? They've got to make sure that it is top notch or people aren't going to go there. And then the last issue is that it's on your own dime. I mean, you got to pay for this. And
Sure is.
so, it's a big ask, I think, to go down there with, so I'm a little bit cautious about having people do it.
Yeah,
At this point, I think, knowing now what I know, it's a little bit different if you go back 5 or 10 years, honestly.
When it
And
comes to, go ahead.
I was just going to say, I'm on a group for primary progressive on Facebook, and someone asked the question about HSCT, and I never jump on and say, don't do it. I've given my feedback in that, for me, doesn't seem to have taken, but, if it's something, but I do say it was the right decision at that time, and they always appreciate it. So,
well, my advice for anybody thinking about HSCT is make sure you're seeing an MS specialist and ask them what they think. That's the answer. Make sure you're having an in-depth conversation with the doctor who can look at the statistics and evaluate the regimen that they're given, that you would be given, and go from there.
Yeah. Do you know, because I've heard all around, like, because I'm 20 something years in. Now, great, I haven't jumped into primary progressive or anything like that. I do see a big decline after Tysabri and things like that. But do you think that because I've often been told, like, you've had MS for too long. You wouldn't be a candidate.
Mm-hmm.
Do you agree with that, or do you think that is?
Well, I don't think it's necessarily how long you've had MS, but since most people who have had MS for 15 to 20 years, the natural history of MS is that you're going to have fewer relapses with time and fewer new MRI lesions with time. And we call that relapsing MS.
Yeah.
So the longer you've had MS, the less frequent those things become. And if we know that HSCT is mostly effective at stopping relapses and stopping new MRI lesions, and those things get better on their own anyway, there is a point where it probably doesn't make sense to do a very aggressive treatment with diminishing returns.
Sure, that makes sense. My MS doesn't like me. If I'm off something, it's like, zap, gotcha. So I don't know. It doesn't like me. But interesting.
Yeah, it is a problem for people who have had MS for a long period, for 20 plus years.
Yeah.
We know that over time, there's a kind of inflammation that is inside the central nervous system that's hard for our current medications to get there.
Yeah.
And we think that drives progression. And now we're thinking that there really isn't a difference between primary and secondary progressive MS, and maybe not even a difference between progressive forms and relapsing forms of MS. It's just a matter of what form of inflammation predominates. And early in the course of MS, there's much more acute inflammation, and our current medications work really well for that. But there is some of this chronic compartmentalized inflammation, even early in MS. It looks like if you treat MS very aggressively early on, we might be able to sort of put a damper on that. Right now,
you sound exactly like the one that I told you that I love so much. Every time you're talking, I'm like, you sound like you guys could have been best friends.
Who is that?
Dr. Howard Rossman.
I don't think I know Howard Rossman, but
yeah, he passed away now it's been 10 years. So he passed away 10 years. I'm in Michigan. He was in Bloomfield Hills, Michigan.
Yeah, I probably didn't cross paths with him.
Yeah, I know he traveled everywhere. He was all over the place. But yeah, you sound very much like him. He wanted to go big guns. No, it is. He was big guns, no little stuff. So and I very much appreciated that, having two little ones at the time. Okay, so I would love, Dr. Katz, if you don't mind, I would love to have you with part 2. I'd love to have Jacob tell his story. Yeah. And there's still questions that I have for you about a million. No, just kidding. I won't keep you that long. But I would love to have you on and talk about Jacob's experience and also some of the questions that I would like to ask you. So if you don't mind.
I'd love to hear about your experience. No, that sounds
Thank
great.
you. Okay.
As long as.
Yes. Well, yeah. If he starts barking, Sophia will be jumping up just right along. So, well, hello. Welcome. We'll stay for part 2. Thank you so much for joining me for another episode of the Move It or Lose It podcast. It would mean the world to me if you subscribed and left a review. Remember, you can find me on Apple, Spotify, Stitcher, and YouTube. New episodes of the Move It or Lose It podcast air every other Wednesday. If you have any suggestions for future guests or topics, please visit my website at www.msdisrupted.com. Until next time.